Hello, everyone. My name is Dr. Morgan Finkel, and I'm an assistant professor and general pediatrician at Columbia University. Today, I'm excited to share with you our study entitled Associations of Infant Sleep Characteristics with Childhood Cognitive Outcomes. As a pediatrician, we do all we can do to maximize child cognition for our patients. And this is because cognition in childhood is linked to many important outcomes, including long-term academic attainment, socioeconomic outcomes like income, and even adult mental health. When it comes to sleep and child cognition, we know that longer 24-hour sleep duration during the school age years and adolescence is associated with cognitive outcomes, including higher intelligence and better memory, learning, executive function, and academic performance. But what about sleep earlier in life, specifically in the first year? During the first year of life, sleep disturbances are among the most common concerns raised by parents at pediatric visits. However, despite the high prevalence of short sleep duration and parent-reported sleep problems in infancy, relationships of infant sleep characteristics and later child cognitive outcomes are unclear. So our primary objective of this study was to quantify associations of infant 24-hour sleep duration and nighttime sleep consolidation with later child cognition. We define nighttime sleep consolidation as the percentage of infant sleep occurring at night, which reflects a more mature infant sleep pattern. Our secondary objective was to quantify associations of daytime sleep duration and nighttime sleep duration with the same cognitive outcomes. We studied participants enrolled in Project Viva, a prospective longitudinal pre-birth cohort of women and their children. Women were recruited between 1999 and 2002 during pregnancy from OB offices in Eastern Massachusetts. Exclusion criteria are listed here. Project Viva staff conducted in-person study visits in infancy when the infants were 6 months old, in early childhood around age 3, and in mid-childhood around child age 7. Our exposures were maternally reported infant sleep characteristics listed here. Our outcomes of interest were measures of child cognition in early and mid-childhood. This table lists the measures and specific cognitive tests used in early and mid-childhood. Here I show our considered confounders, including child race and ethnicity, which was used as a proxy for structural racism and systemic inequities. We utilize multivariable linear regression modeling to assess the relationship between each exposure and outcome separately. We use a stepwise approach to build our models, first with a priori confounders and then with additional confounders that influenced our betas. Our final fully adjusted models controlled for child sex, maternal age, maternal education, parity, household income, and child race and ethnicity. Now I'll summarize our results. Our analysis included 1,215 mother-infant dyads. Most mothers reported their child's race or ethnicity as white, and most mothers were college graduates. Now I'll highlight some of our regression results. To orient you to our tables, the models for each sleep measurement are in the left column, and the cognitive outcomes are in the top row. The numbers in the tables represent the betas in the regression models, or the difference in early childhood cognitive scores per 1 unit increase in the infant sleep measure. These results are from Table 2 of our results. The results that have a confidence interval that do not cross 0 are in bold. Highlighted here, you can see that in the fully adjusted models, the primary infant sleep measures were not associated with cognitive outcomes in early childhood. This table shows the results in the same format, but for the outcomes of mid-childhood verbal and nonverbal IQ, as shown in Table 4 in the manuscript. Here we highlight that longer infant 24-hour sleep duration was not associated with mid-childhood IQ measures. On the bottom of the slide, we highlight that higher infant nighttime sleep consolidation was associated with higher mid-childhood verbal IQ. On average, each 1% increase in nighttime sleep consolidation was associated with a 0.12 point difference in verbal IQ score. This table shows some regression results for the secondary sleep measures of daytime and nighttime sleep duration for mid-childhood IQ outcomes. Here we highlight that longer infant daytime sleep duration was significantly associated with lower mid-childhood verbal IQ. In conclusion, in this prospective cohort study assessing the association between infant sleep and early and mid-childhood cognitive outcomes, we found that higher infant nighttime sleep consolidation, but not total 24-hour sleep duration, was associated with higher mid-childhood verbal IQ. We also found that longer infant daytime sleep duration was associated with lower mid-childhood verbal IQ. Collectively, these results suggest that infants with more mature sleep patterns had better verbal skills in mid-childhood. Thank you for taking the time to learn more about our study, and please reference our manuscript for more information.